Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm with Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I am doing fabulous. I heard there was some excitement in your house this weekend.
Oh, we did. We had our bridging ceremony. So we officially have a brownie in the house. My other daughter is now a junior. So we have lots of exciting, it's that time of year, right? Graduation and everybody's moving up. But it was really fun to corral 10 7-year-olds together and create a rainbow bridging party. And it was just all of the fun that you ever wanted to have. So
fun time.
Jeff, I'm really excited. We're taking Dean's Chat back on location on the road, this time at the the APMA conference this summer in Dallas, Texas.
That's right. We'll be in Dallas at the Gaylord Hotel between July 24th and 27th. And we'll actually be recording Dean's Chat episodes at the Pod Expo, which is in the exhibit hall.
Yeah, and I heard it's adjacent or right next to a pickleball court, which sounds like a lot of fun.
Yeah, they're going to play pickleball actually in the exhibit hall. And I think it's sponsored by Skechers. And rumor has it, Megan McClellan's been training for it.
Yeah, I'm going to need to do some training for it. I thought I might recruit your son to give me some tips.
I'm sure he'd be up for that. Well, I am really looking forward to catching up with all of our friends and colleagues in Dallas. And if you've not registered for the APMA National yet, go to apma.org/thenational and sign up today. Please do stop by the booth too when we're in Dallas. We'd love to interview you for a Dean's Chat episode.
Yeah, we love connecting with our audience and our past and future guests. So please come by and say hello. And now back to our incredible guest on the show.
Well, Joe, I'm super excited about our guest today. I'd like to introduce Dr. Timothy Miller to Dean's Chat. Welcome, Dr. Miller.
Dr. Jensen, Dr. Richey, thank you both so much for having me. I'm really excited to be here.
Well, we thank you for carving out the time to be with us. And Dr. Miller, we're very informal on Dean's Chat. If it's okay with you, let's go first names, Tim, Joe, and Jeff.
Sounds great. I'm down.
Yeah, Tim, thank you so much. I'm so excited about today's interview. You and I first met just recently, actually in person. I've been kind of following some of your content online through the Florida Podiatric Medical Association. And so I'm excited to kind of dive into a little bit more of your individual experiences and then also highlight on some of the fun things that you and I were nerding out about in an airport for several hours. But before we do that, we're going to take a quick word from our sponsors and then we'll be right back. All right. So, Tim, I am just thrilled. Just to give you a quick bio so that our audience has a little introduction. You're currently in private practice in Orlando, Florida. You do also currently work with residents. And so we're going to dive into resident training and all the psychology behind some of that. But you went to the New York College of Podiatric Medicine and got your Doctorate of Podiatric Medical degree there. And prior to that, did your Bachelors in Psychology with a minor in Bioethics from Johns Hopkins. So I'd love to start here because that's a fabulous undergrad experience. Tell us a little bit about your podiatry origin story. How did you find out about podiatry? And tell us about that.
Sure, absolutely. This is like so cool. I'm fanboying a little bit because I've watched these Dean Chats and I've heard of, people who've been on it and have seen their reactions and have seen how you guys have really helped bring podiatry to such a cool level. And I've always thought podiatry is cool. Obviously, I'm biased, but just to see that, I think is just such a great thing to encompass. I see there's students, there's residents, there's all different backgrounds. So thank you for doing this because I'm incredibly honored to be here. And then following up with your question there. So I, like every high school football player, dreamed of playing in the National Football League. And at 5'10" and a half, which I round up to 6 feet. So now everybody knows, as an offensive lineman, I wasn't going any higher then. So, but I had the academics. I graduated sixth in my class of 650, somewhere around there. So I knew academically I wanted to go somewhere that would challenge me. And I knew eventually I wanted to go into medicine. I actually wanted to be a veterinarian first, but my mother was an ER nurse for almost 30 years. So she would come home and tell me all of the gross stories that she would have throughout the day about people getting things stuck in places and, things happening. And I would just like bag of popcorn, just eating it, like going like this, listening to it. And it just really excited me. So once I knew I wanted to play football, knew I wouldn't be playing at a higher level, I said, well, I have to balance academics with athletics. Where can I get the best of both worlds? So I applied to multiple schools, including some Ivies, and met with the coaches at Johns Hopkins, Coach Jim Margraf, and he became a second father to me there. The second I met him and I got onto campus, I just knew it was a place for me. I felt very comfortable with my teammates already and just comfortable with the coaching staff. So, and I don't know if you've ever been to the Hopkins campus, but it is fantastic, gorgeous. Maryland's a great state to be a part of. So I knew it was just a right fit for me going there. And I knew that obviously Hopkins carries the name, the medical name with it there. So having that on my resume, I kind of knew that that would help propel me in the future. I carry some weight there. So realizing that animals can't talk to you and it's kind of difficult to diagnose that, and hearing my mom telling people what was wrong, I said, okay, I think dealing with people might be more up my alley. So it was October of my sophomore year. I was a starting offensive lineman, and unfortunately, my running back got tackled behind me, and I tore my ACL and I hurt my ankle all at the same play. So I had surgery on my knee. I saw a orthopedic for my knee, and I saw a podiatrist for my ankle. So we had team doctors who were on board, and just speaking with them and getting their thoughts on life and academics and athletics and balancing family. I was like, okay, well, this is the time to start shadowing. I'm a sophomore in college, so let me go ahead and get into these different specialties. And I started with them. I started with the orthopedist and I started with the podiatrist. And just seeing not so much of the conversations that I'd have with the podiatrist, but more of the interactions with the patient and how genial it was and how relaxed it was and how natural it became, as opposed to, again, nothing against other professions, but just I saw sometimes it was a little robotic, and I felt that podiatry was a more personable field. And so a little more background about me. My father was a rescue worker after September 11th. So I'm from New York originally. And unfortunately, he contracted lung cancer and that metastasized, and he ended up passing because of it. But throughout his journey, I went with him to his doctor's appointments. So I shadowed hematology, oncology, nephrology, all these different fields. And I could see times when he was treated like a number versus the time he was treated like a human being. And I thought to myself, if I ever become a doctor, I know to treat my patients like a human being. And I saw that with the more I shadowed podiatry, the more human I felt, because I felt like I was actually helping people. I wasn't punching a clock. I wasn't trying to meet some RVUs. I wasn't trying to gain surgical cases because the hospital is telling me I need to do this. It just felt like a more real lifestyle for me, and seeing that with multiple podiatrists who I interacted with and seeing the lifestyle they were able to bring not only to themselves, but to their families and to their patients, it was a career that I fell in love with even before I applied to school. So I'm a born and raised New Yorker, and being in Florida, I feel like I'm back in New York. I'm in Central Florida. There's a huge contingency here. So, I knew I wanted to go back to New York. My father passed in my senior year of college, so I knew I wanted to go back and help my mom. So I knew the NYCPM, the New York school, was my top choice. I'd applied to others, but I knew that that was where I wanted to go, and I eventually got in, and the rest is history.
Jeff, your thoughts?
I love that story. I have this mental image of you being an offensive lineman at 5'10". How many pounds?
So I was 280 pounds.
Oh, no way.
200.
Wow.
I have lost almost 100 pounds. I'm almost 100 pounds less.
Oh, all right.
So you got to think, though, when you're that big, it's actually hard to maintain a weight like that. So I was lifting all the time, training. I would go to Burger King and probably consume about 15,000 calories per meal.
Wow.
And I loved it. I mean, it was great. I was 18, 19, 20, not a care in the world about heart disease and all these other things. And it was funny. So as an offensive lineman or as a lineman in general, you'll notice they're very competitive. There's a very pack mentality. And I think that comes into medicine to play as well, too. I think medicine is a very team pack mentality. And we all competed with each other. It was like, well, I'm not the fastest, but I'm going to be the strongest in bench press or something like this. So we were always competing, but we knew that competition bred success. And the second our playing careers were done, we were all competing with how much weight we could all lose. So, but looking back on it, I probably wasn't the healthiest. That going back on, obviously, I know more now, but it was just this competition of getting healthier at that point. So we were doing CrossFit, we were dieting, we were exercising, actually cardio. When you're an offensive lineman, you don't do much cardio. You run about 10 feet and that's about it. But we were just helping to make each other better. And to this day, we're still texting each other, about, my kid just scored 3 goals in a soccer game. What's your kid doing? Like all that. So we're still competing in a fun way. And when we go to these reunions, we're always joking, laughing around. But I think that pack mentality and that team effort, what I learned really has helped propel me into my career now. And I really enjoyed being a part of the team in podiatry, being a part of ACFAS, ABFAS, FPMA, APMA, all those ones that I think that's the team approach to our profession that's really, pushing us forward. And I've always had that mentality. And that's why I love doing these things and getting involved and pushing our profession.
That's great. I'm still trying to imagine you at 280, but.
So here we go.
There you go. I like it.
I got pictures, man. I'll send you pictures.
All right. Yeah, we could put a picture on your thumbnail, one at 280 and one at 180.
Yeah.
Before and now, then and
right.
now. Yeah.
So there you go. Joe, may I ask one more question? So Tim, I'm just fascinated. Anytime an undergraduate student applies to our school with a psych major in undergrad, can you talk about that a little bit? How that impacted your mindset, perhaps, for medicine, or how it even impacts your patient care today?
Absolutely. And it's funny because I think I've always practiced some sort of psychology. That's where I kind of going back to before, it was the patient interaction and the way patients felt leaving the office is what really one of the things that drew me to podiatry. And I think automatically, when you sit down in undergraduate, you're reading from a textbook or you're talking with a professor, and you really don't, in psychology especially, you don't get a lot of real world experience in undergraduate unless you do research. So I started doing research through Hopkins, and it was really child psychology that I started with. And seeing the way the clinical psychologists interacted was almost the same way that podiatry was interacting with their their patients. And a lot of times, and I'm sure you both can attest to this, you're sometimes have to baby some patients, and not a baby, but you're caring for them, you're comforting them, if there's a traumatic incident, you're walking them through the process, the post-surgical process, even something just as simple as heel pain that they can't play pickleball. By the way, pickleball is huge here. Is it huge in Arizona too?
Oh, big.
It is. And they have indoor pickleball courts that are popping up like daisies right now.
See
because it's so hot.
Yeah, well, it's 100 degrees here too, so I think that would actually work.
You're hotter than us. It's only we hit 90 today. We're getting there.
We hit triple digits today, and I felt it. So, but when you get even these patients and who are active and they want to continue to be active because they know that once activity stops, things go downhill, right? How many times have you seen? And I say my grandfather, for example, my grandfather was an FDNY firefighter, and he was 93 and just looked like he was 70, went through a quadruple bypass, came out the other side, no problem. But then he broke his hip and he couldn't move anymore, couldn't move as much. And that just went downhill. And people talk about it. They say, when I stop moving, things are going to happen. So how can you help me move? And I always take that as a problem-solving challenge. And I hope we get into this later, Joe, about some of the parallels that we had talked about before. But this is a parallel where problems are always going to surface, and how you can fix those problems and how are you able to attack them. And that's why that psychological approach with the patients, that you're in a comforting manner, but an educational manner, making them feel that they're a part of your team, that, you're not just saying, here's a script, this is what you do, go, that you're saying, these are the steps we need to take. This is how we're going to do it. How are you feeling? Okay. Is that something? What else, do you think that we can do? What are some other things that you want to do? And one of the questions I always ask my patients at the end is, it's a question where, and I'm sure you ask it too, is that, what other questions do you have for me? And I used to ask that in the beginning, but I don't ask that anymore. And I noticed that because a lot of patients will feel on the spot. And they say, oh, no, I'm good. And then they'll leave, and 10 minutes later, they'll have a question. They're like, all right, I can message them or something. But I always tell them, a patient with this diagnosis or a patient who has these symptoms will usually ask me this. And then I'll go into some other things I may not have hit on, or some other things that can happen. And they're like, that's great. Thank you so much. And I found that psychological aspect of being comforted weighs much more than giving a prescription, giving a shot, and saying, okay, get out of here. See you in 3 weeks.
I like that.
Sorry if that was a long-winded answer. You got
I like
it for a sec. So
it's stimulating all kinds of more questions for
really awesome
discussion.
And I'd love to kind of sit here for a little bit, Tim, if you don't mind, because I think what you touched on is such an important point in terms of how we make our patients feel matters. Mm-hmm. And I'll switch to the opposite side at the phase of life that I'm in, getting to be a patient, which is humbling, right? But you walk in and I have an appreciation for the physician's time, that you want to try to be as efficient for them in the way that you present whatever it is you're there for. That if you have someone who responds to you kind of very quick and maybe even flippantly, or they kind of brush it off, like I have found, like I will immediately just like, all right, like I'll just kind of shut down and be like, appointment's over, right? Like I'm not going to engage with you about the whole reason that I scheduled time off of work, navigated all the family stuff to come and do something for my health. And so if I take that as my own experience and put myself in a position like a patient who potentially is looking at something like an ulceration that could dramatically change their life and their risk profile for things like an amputation, or someone who's further along that spectrum, or the flip side, right? Somebody who's here, they have an injury, maybe it's a chronic injury, maybe it's acute, and they're trying to figure out, how is this going to impact my life? And so I would love to kind of go down some of the psychology stuff. And one of the things that we nerded out about together in the airport, actually, even before the airport, and then certainly in the airport as well, we're both Marvel fans, Jeff. And so we were talking about different Marvel characters, because the Marvel universe is an amazing psychological experiment, right? I'm going to throw the ball back to you, though, for this one, Tim, because I would love to get first, who's your favorite Marvel character? And then what do you see as some of the parallels to what we see in the Marvel films, and how we can take that into our daily life?
Well, absolutely. So how much time you got? Like
we still have lots of time.
Okay.
Oh, yeah.
Good.
Yeah. It's open-ended.
We'll just go to part 2 if we don't get through all your accomplishments yet.
I'll go back now for my psychology, because I think we're hitting some good topics now. So I was 280 pounds, but before I got into football, I was a fat kid, right? And that had some psychological impacts on me and how I perceived myself and self-confidence. So I have 2 older brothers. I was born in the late 80s. My older brothers were born in the early 80s. So even though I grew up in the 90s, I felt like I was more of an 80s kid. And that 80s time was when really comics really became into a lot of things. So I was not force-fed it, but it was right in front of me there. So that's when I really started to read comics. And I saw that these people or these characters that are painted on these pages are human. And that, I think Marvel was really the first one to have a psychological component. And that's where I really connected with Spider-Man. And I know a lot of people are going to turn around and say, Spider-Man, obviously, he's the most popular, blah, blah, blah. But he was a teenager with no confidence, right? And that's what I felt, right? I was like, I had no confidence. I thought that I wasn't the best at things, but if I worked hard, right? If I worked hard and I kept working and I stayed true to my values and stayed faithful to my family and my friends, then that was something I knew was going to push me through whatever adverse events came my way. And so that's why I really resonated with Spider-Man initially. And then when I got more into the college aspect of it and trying to become more academic with research based, and having almost like a secret, that was when I resonated more with Bruce Banner and the Hulk, because my father was diagnosed with cancer right before I left for college. And I didn't want anybody to know. Like he was in New York, I was in Maryland. I wanted to just separate myself from that. And having that separation there, I felt like was Bruce Banner trying to separate himself from the Hulk. And he was walling that off and separating that off. And when he became angry at things or that came back into his mind, he would lose control. And it was, again, I was an 18-year-old kid, like trying to control emotions of what was going on. And obviously other things going on with classes and a whole different environment, first time away from home. So I was trying to, but I knew, again, knowing to go into medicine, trying to be the Dr. Banner, trying to be a Dr. Miller, but also having that part of me that didn't want to let out, didn't want anybody to know, but sometimes it did come out. And when it came out, it wasn't always the prettiest thing in the world. So that was that aspect of it. And then when I got married and had children, that was more of the phase of a Captain America, Steve Rogers, because I felt like I was this symbol and trying to be an example for my children, and then doing my leadership roles with multiple organizations, trying to be showing that I'm a leader and trying to be that symbol for others and trying to say, hey, listen, we're all in this together. This is a rallying cry. We're here to support each other, reach out if you need it, and being that one that people can rely on.
I love that.
Did you know APMA provides help with public health initiatives such as fall prevention, opioid abuse prevention, and addressing health disparities?
Did you know the APMA provides over $400,000 in scholarships annually to students pursuing podiatric medicine, helping the next generation of foot and ankle specialists?
If you're serious about this profession, if you want to grow, to lead, to make a lasting impact, join APMA today.
Jeff, any thoughts before I jump into it? And
No, you should jump into it, because
Okay.
I've never delved that far into it. I'm still back like watching the Joker and Batman and Bruce Wayne, but they're not Marvel.
They're not. But we can't mix universes. It's going to get way
mix
too complicated.
That's why I need to stay in my own lane here.
Fair enough. And what I think is just so much fun is, again, this is a side of you that I'm sure that the rest of the world maybe isn't as familiar with. To touch on a couple of accomplishments real quick, and then we will kind of, again, translate and pull some of the fun stuff in. You're a clear leader in our profession, Tim. You're not only part of the Young Leaders panel for the APMA, the Young Physician Liaison Education Committee. You've been part of the ACFAS Chris Mahaffey Leadership and Development Program. As you have gone through this transformation, and you could use, again, any one of the origin stories, right? And I love that you've like cataloged different phases of life with them, because it's just a fun way. It's a fun lens to look at things through. As you've gone through your different experiences, can you talk a little bit about, you had mentioned, like with Bruce, right? You kind of want to suppress and like, oh, I'm going to hold this, I'm going to hide it. Can you talk about some of the opportunities or the ways that you found solace in that? And then some of the flip side, right? Because the other thing that I love with Marvel is this idea that there really aren't, there's obviously villains, right? But the villains also have a story, and they all have It's like, no one's really a bad guy. Like there's a reason why they're bad. Of course they're bad. But like, so in my mind, as I look at things, sometimes there's always like the flip side to that coin, right? Like what have been some of those moments for you? And you could pick any part of life to kind of talk about it, where you have found both benefit and opportunity challenge from those different psychological experiences.
Wow. That's a great question.
A heavy question.
That's heavy. No, I'm going to get a cup of coffee for this one. Okay.
Well, in fairness for the audience, I'm not even kidding. We had like a 3-hour discussion. So like I have some of the back stories that we won't be able to squeeze all into a 40-minute episode, but
so how about that? I think let me focus on my podiatry journey there. I think that's probably an easier way to kind of go about this. I can go back to when I was like 7. So I think, and tying in the psychological aspects of things before, when you're looking at yourself in the mirror, right? You have completed undergraduate, you've completed podiatry, you've completed residency, you've completed fellowship. There's always a tinge of self-doubt. Mm-hmm. And I think that self-doubt is what has driven me through to continue to push our profession, to continue to expand our roles and be a team leader and have an impact on our team. And people call it, imposter syndrome. And you probably have heard that as well too. I don't call it imposter syndrome because I don't feel like I'm playing somebody else. I don't feel like I'm, Dr. Tim Miller, and then at home I'm, Jim Giller or something like that, but it's something where the self-doubt, because you're not perfect and nobody's perfect. And if there was a perfect person, then I don't know, it's not possible. It's not even feasible. So that self-doubt to not achieve perfection, but to achieve the best that you can with what you're giving and pushing yourself forward, that's where that psychological comes in. And that's what has motivated me since my early days. Knowing that I've pushed myself with the tools that I have to become who I am now, what am I going to do to push that doubt aside and to propel forward? And tying back in with Marvel, and I think overall, I know we have, I told you, Spider-Man, Hulk, Captain America, but I think overall arc is Tony Stark. And I'm not an alcoholic, I promise, because I know there was a storyline with that and all that stuff. But what I'm saying in that respect is that he was a person that even though he came off as somebody who was so self-confident, he always had his doubts, right? Mm-hmm. And he always doubted himself. And he knew he wasn't sure if he was the person that was going to lay on that grenade to protect everybody else, right? He always doubted that. But when the moment came, he did, right? That doubt is what drove him to become the person that he was. And I think that doubt is what has driven me throughout my entire life. I think everybody always has naysayers. Like, people are always going to try to, outside of the profession, to say something and be like, oh, you're too short to play Division I, or, oh, you didn't get that 100 on that test, or, you could have thrown that screw differently. It's not perfect, right? And that's what I say to myself. Well, it's not perfect, but at the end of the day, as long as I am making sure that I'm doing right by my patients, and I'm going to be the one that's going to turn to my patient and say, I did everything I could for you, and I would have done the same thing to my brother, sister, mother, that is the ultimate goal. And I think that's where it plays back into Marvel, where that ultimate goal was he was able to eliminate that self-doubt. And that's the chasing of helping to eliminate that self-doubt.
I love that. I think highlighting normalizing that we all feel some self-doubt, and it's actually not always bad. Like, it's okay to lean into something. I remember I was taught, and we're going to transition into how this impacts your leadership style, so you know kind of where we're going. I was talking with a young resident. She was actually an orthopedic resident, and she was about to go on stage and present her research. And it was one of those like ridiculous serendipity moments for me, because I could physically see how nervous she was. And it was that moment of like, the only thing I wanted to do was give her psychological safety. Like, you are going to be okay. No one knows what you're presenting better than you. And like trying to like wrap her in this idea of support, because she had everything she needed. She just needed that little bit of confidence, you know? And I watched her lecture and she did amazing. She did a great job. So as you have, you completed your fellowship, just to go back again, so make sure I'm hitting all the traditional Dean's Chat things. You completed your 3-year surgical residency with Morristown Medical Center in New Jersey, and went on and did your reconstructive fellowship and limb deformity correction in Ohio. And now you currently work with residents. As I had mentioned, you're part of the leadership development committees for both the American College of Foot and Ankle Surgeons as well as the American Podiatric Medical Association. How do you see your leadership style and how the things that you have been through have impacted your leadership?
Yeah, I think that's awesome. I think it's a great question, because throughout the leadership development program with Chris Mahaffey, there was a section that was specifically leadership styles. And what you learned at the end of that section was you're not one style, right? You're fluid. And fluidity in leadership is key. There are residents that turn around and they need a stern, someone who's going to tell them, this is what you do, this is how you do it, and this is how it needs to be done every time. And if it's not done this way, you don't leave until it's done. But if you're like that with somebody who may be more self-sufficient, maybe more of a self-learner, maybe somebody who's preparing a little more, you do that can throw them off mentally. And they say, well, I had it ready to go this way. I knew it was going to work that way. I knew I would have accomplished everything at the end of the day doing this certain way. Now I'm doing it this other way, and that doesn't work for me. And that's creating more work, and that's creating more mental and physical anguish, right? And the key to being a leader, especially when developing up-and-coming professionals in our field, in my opinion, is figuring out the individual personality. And that's where psychology comes back in. That's where a simple sitting down with a cup of coffee and you're just talking with them. And my most impactful meetings with my attendings and my fellowship and residency were the ones who just sat and talked with me to get to know me. Because there are plenty of ones, and nothing against them, there are plenty of ones that are punching a clock, right? They're trying to do this. They've been in clinic all day. They've been in surgery all day. They need to get home, blah, blah, blah. They won't sit and get to know you. And that is completely fine. There's nothing wrong there. But if you've desire or you accepted the role of a leader and want to pursue leadership again is a team effort. And even though there's a couple of leaders with a bigger team, it's all the buck is passed all around. And that's where working with residents really comes in. It really is an individual getting to know them and putting that perspective in your eyes and saying, well, I was a resident. If somebody said this to me, how would I feel? Or if somebody did that to me, how would I feel? Turning around and giving that perspective to them and letting them fly but not fall according to what they need is something that has expanded their roles, and they've flourished into amazing doctors and fantastic surgeons. And I get text messages from them saying, hey, thank you so much. Remember when we did this together? I had that thing come in. I knew exactly how to handle it. And it was because of you. And thank you. And that is incredibly rewarding. And, I'm not too far away from residency, but I'm far enough to look back and say, there are things during that residency that I know helped me to who I am now and the patients that I see now. And those are the things I want to pass on. And same thing with fellowship. It's very easy to get bogged down in the day-to-day activities, and residents are the same way. But no, telling them and changing your style to them to let them know that there is a light at the end of the tunnel and that, again, everything will be okay. This is not the be all and end all. You are going to survive this. You are going to be a doctor. You are going to treat patients, and your dream is going to come true. And that dream is going to be beautiful. And I am just a cloud support structure on that dream. But I am here to support you now that I'm your attending. I'm here to support you throughout your journey. And I still talk to my attendings about some cases that I may not know. I still talk to my fellowship people about that. I talk to my co-residents. I talk to my buddies from school. And again, that team approach, I let the residents know that they're a part of my team and I should be a part of their team.
Jeff, what's your thoughts?
Well, this is so good. I mean, we always think about life and, from a distance as linear, undergrad, school, residency, fellowship, practice, but it's anything but. And I think a lot of that comes back and it's inherent in all of us. Of course, you talked about self-doubt, right? And that self-doubt, oftentimes you can go a couple directions with it. You can create fear and going down one path, or self-doubt could perhaps enable you to interact with a leader, with a residency director, with a professor that will take you down a path of success, so to speak, or confidence, competence, however you want to look at it. But I see that every day. And Joe, I think getting back into academics for me, even though I was teaching in a residency program in Colorado, you see that self-doubt early in the game, right? And so a lot of the time I find myself as the dean as being more of a cheerleader for our students when they come in who have that self-doubt. And everybody, as to your point, everybody responds differently to different types of guidance or leadership or mentorship. So all of this is just so good. And I think it's interesting that so young in your career, Tim, you're recognizing all of that, because it took me a little longer, actually.
Just to kind of go off what you were saying there, Jeff, and I always impart with my residents too, like I always talk to them about self-doubt, you're going to have it. And my graduation message to them every time, I didn't tell them to the beginning, I tell them at the end, is saying, are you going to let that self-doubt consume you or push you forward?
Yes, absolutely. And it helps to have help.
It does. And listen, again, it's a team sport. It's a team, and there is competition, but as long as you're looking at yourself and saying, I'm not alone, I'm not an island. Medicine's not an island. You're not a team sport. Complications happen. Who can you rely on? And that's having that safety net is incredibly important.
Absolutely. This is so fun.
I'd love to go back. Go ahead.
I'm loving this discussion. Go ahead, Joe.
I'd love to go back to one other thing that you said before we go into some of the fun kind of rapid fire stuff. You had mentioned you will often reflect back to your own experiences as a resident or a fellow and kind of draw on those to help you figure out how you want to handle a feedback session. Can you give us a little more granularity there? I like this idea. You meet them where they're at, give them the feedback that they need, not necessarily what they want, but do it in a way that allows them to feel that psychological safety to hear what you're saying. Mm-hmm. Are there things, and again, you don't have to get like super personal, but what are some of the top 3 things maybe that you resonate with as you think about delivering feedback? Maybe we'll say some difficult feedback for someone.
Some difficult feedback. So you're talking about more approach, or you're talking about more of like tips of what to tell them with that feedback?
Like, how do you handle that? Like, what is your framework?
They know from the get-go that I'm going to be honest, because I always say to them that if I'm not honest with you now, somebody's going to be honest with you in the future, and you may not like that. Or it may be a situation where that honesty is a lawsuit coming your way because you didn't do one thing that should have been done or something, right? So it's better to be honest and straightforward with you now. And you may get mad at me and you may get upset, but you'll thank me for it later. And I'm not one to be mean. I'm never going to degrade somebody. But when I approach the tips and tricks that I would give is talking about psychology and bedside manner, kind of going back to that. I apparently I'm one of the very few people that talk to my residents about psychology and about bedside manner, because when you're in residency, the patient interaction, depending on the amount of clinic that you had, or the amount of surgeries that you do, you may not get an incredible amount of patient interaction. And that a lot of times I'll come in with a patient, I'll introduce myself as the attending, and I say, this is who I am, and this is my role here. But Dr. So-and-so has the one that's been seeing you every day and has been taking care of you. So I'm going to let Dr. So-and-so kind of guide this conversation. And before that conversation, I'll talk with the resident about, hey, this is the plan. This is what needs to be done. And then they'll go in and I'll just watch their mannerisms. I'll see how they look. And it's something as simple as pulling up a chair and sitting down next to them, right? When they're laying in a hospital bed, or if they're sitting in a clinic chair and your hand is on the door, or you're standing up, right? That signals to them that you're on a time crunch, that you're not devoting that time. But simple gesture is sitting, simple gesture is smiling, simple gesture is, obviously COVID changed things. You may not necessarily shake hands, but you give that warm smile with your eyes, right? And just seeing their mannerisms, because I tell them afterwards, I said, hey, listen, that either that was great, or hey, you patient didn't really feel comfortable with you. They didn't really know, even though you've been seeing them every day, they weren't sure about the plan. They weren't sure about your explanation, and they didn't feel comfortable at everything. Now that necessitates us going back into the room and me taking over the conversation. But it's the bedside manner that I'm always looking at. And I'm probably the harshest critic on that, because that's number one, is that's how the patients are going to trust you with their plan. Because patients have self-doubt too, right? You're talking to them about a major reconstruction, or you're talking to them about an amputation, and they're going to doubt things, right? They're going to say, whoa, well, maybe we shouldn't be doing this, right? But it's your job to figure out what's best for these patients. So what are you going to do to tell them, or how are you going to act to not necessarily convince them, but to know that this is the right plan, and that even though you're the doctor, you're the leader, they're on your team and you're on their team, right? Yeah. That's that approach, that back and forth with them there. So I'm definitely their harshest critic on that, their bedside manner, number one. Number two, also kind of going to that bedside manner too, I tell them, now that I'm in private practice and I own, co-owner of my own practice, is that I rely on those patients coming in, right? So that bedside manner with one patient, I know that if that patient's happy, then they're going to tell two people, and then they tell two friends, and then they tell two friends, and so on. And it just helps to grow, right? You can do all the advertising, social media, billboard signs in the world, but really word of mouth is probably the best form and the cheapest form of publicity that you can get, good or bad. So I tell them that too. If you're looking to go into private practice, or, even academia, you have that academic settings as well, but there's also word of mouth with those settings too. So that's where that stepwise approach is. And number two, how do you deal with your fellow residents, especially how do the older senior residents deal with the newer incoming residents? Because I had seen and heard some stories that probably weren't the nicest, of older residents not treating the younger residents as well as they should be. Nothing abuse-wise, but, not supporting is what it should be. And it's like when you have a kid, those formative years, you give them the milk because they're growing. It's the same thing as a resident, right? You learn in school, you're in school, you're dealing with school, but then your practical application starts in residency. And those are your formative years of practical. And stuff I learned in residency, I still do now. And I talk to people in different parts of the country that say, oh, that's not the way we do it. We do it differently, but that's formed who I am now. And the older residents have to nurture that, right? I have to know what's right or wrong, and it's easy. So for example, I had my first night on call in residency by myself. I had a patient come in with a horrible infection, gangrenous second toe, that I took a look at their toe, I'm inspecting it, and their toe fell off in my hand. And it was in my hand, and I didn't know what to do. My first instinct was to throw it out, because it's trash now, it's not needed. But that's when I'll be honest, I went to go throw it out. And then my senior resident, because they were around, came in and saw me and was like, no. And actually he pulled me out of the room and said, that's pathology. You got to send that to pathology. You can't just throw that at that. First of all, I didn't even know to throw it in the red bin. I was going to throw it in the tan bin, but if I was doing anything, she'd go in the red bin. But the way he approached me was like, listen, I'm here to help. You're not sure. The second you think of, that's when you put everything down, you take off your gloves and you call me. And that's what I'm here for. And I saw that and I was like, oh, all right. And that's when I was a chief resident, that's when the residents coming in, that's what I was like. I didn't care that I was the third year and you shouldn't be bothering me. You shouldn't be calling the second years. No, I'm a third year and you're learning on what to be. And you're ultimately going to be a reflection on who I am, right? You're going to tell people what program you went to, right? And if people see you and are not a fan of you, and then they're like, oh, well, that program must not have been what it should be. And then they talk to me and I was that part of that program. Then I'm like, all right, well, they're automatically going to have some type of bias towards me. And I'm like, that's number one, that's not should be. Number two, you have to imagine treating those patients like how you would want to be treated, right? The golden rule, do unto others. And it's easy to lose the golden rule, especially when you're so busy. You have 15 consults, 5 surgeries that you're trying to get done in that day. But that golden rule is what's going to carry you. And that's really what I push on. That's my other lesson with the residents too, is the golden rule.
I love that. And I heard a couple things that I just want to kind of reframe back. So honesty, being open and honest, but creating kind of a safe space to give that feedback. It's amazing how powerful just pulling up a chair and sitting next to someone, either a patient and that psychology that you talked about there, or with a resident or student to give feedback, where you don't create a power dynamic with your body language or physical space. I had a friend who was a breast cancer surgeon, and she was such a remarkable person to talk to about bedside manner. And she had said, one of the most profound things that she learned is as soon as she said the word breast cancer, it didn't matter what happened after that, because people would just they would go into that mode of shock. So she got in the habit of reading the report or giving them the diagnosis. And then she would just sit there and just pause. She would just create that space to let it settle. And she said she would sit there as long as necessary for them to say, and what happens next? Because now they're ready to hear and I thought, that is so incredible. And how many times do we walk in a room, and to us, we do this all the time, right? Oh, Mrs. Jones, I'm so sorry. Whatever's not working. It looks like, infections progress, whatever. They're in a hospital bed. We're going to have to take you to surgery. And everything just starts to happen so fast. And as a patient, not having that opportunity to really digest this massive diagnosis for them. I thought that was, and so your answer was very reflective of the conversations I've had with her. And it has helped me be a better empathetic provider in terms of giving people difficult conversations to have. So I appreciated that.
No, of course not.
Oh, go ahead.
And I'm so sorry to interrupt, but that's kind of turning back to what I had said before about my father. I had saw who treated him like a number versus a human being, and just how he was afterwards. And again, coming back to that psychological, but that's a huge impact on what we've been talking about.
Yeah.
I think it's interesting to mention that you think people have certain personalities and bedside manner, but it is moldable over a 3-year period. And, so much we think sometimes of emotional intelligence, and some have it and some don't, but it is something that you can learn, the bedside manner aspect. And I think that's huge, because Joe and I are always talking about knowledge being a commodity, and, the patients don't care what procedure you perform on them. They just want to have confidence in you and know that they're in good hands. And that is such a non-verbal, and it's verbal, but it's also non-verbal. It's the whole physician experience. And I think it's great that you're acknowledging that with your residents.
Thank you.
Joe, we should jump into some rapid fire. Mine aren't always rapid fire, though. I got some kind of deeper questions, but we'll give it a
Maybe
whirl.
We can do a couple deep ones just because of the psychological theme of the day.
All right. Can I start?
Yeah.
Okay. Being a psych major, in your life, in your career, as you project forward, using Maslow's hierarchy of needs, what does self-actualization look like to you for Dr. Miller?
Ooh, self-actualization. It looks like when I can get to a point that I can confidently say that I have done the best I could, and I can put my head on that pillow at the end of the night and said, I did right by my wife, I did right by my sons, I did right by my patients. I think I strive, and that's my self-actualization. And that, to me, is when I can cast as much doubt aside as possible.
Oh, there you go. Talk about tying things together.
Yeah.
I like that. Your turn, Bill.
Favorite books that have impacted, a book or books, depending. No more than 3.
Oh, all right. Here we go. So The Phantom Toll Booth is one of my favorite books of all time. And it's usually like a 6th grade book that you read, but it is awesome. Have you guys read The Phantom Toll Booth?
I have not.
It has been years.
I know.
Yeah.
It is.
Yeah.
It is awesome. And the reason I like The Phantom Toll Booth is because one of the messages is that things happen, right? Things happen that you don't anticipate. You can enter a door where you expect one thing and something else happens. How do you react? Yeah. What are you going to do? How are you going to respond? And when I first read that, I just thought it was just a cool story. I was in 6th grade. And the times I've read it since, I have just gotten so much more meaning out of it. Mm. So that, to me, is absolutely fantastic. So I am a huge Harry Potter fan as well, too. Obviously, I'm a nerd. We're going into the Marvel and Harry Potter. And I personally think his self-growth with his self-doubt was really seen in the Goblet of Fire. That's my favorite one. That's because it's the Triwizard Tournament. He did not put his name in there. His name came out. He didn't think he deserved to be in there. He was doubting himself. Others were doubting himself. But he proved that perseverance and intellect and relying on your friends and having that trustworthy net helped propel him forward. So I think I love that book there. And this one is going to be a shout out to my wife as well, too. This is her favorite book, is The Giver. So The Giver, they made it into a movie maybe about 10, 15 years ago. But The Giver is about you're born into certain roles in society, right? And you're automatically in these roles. And that's your job. That's what you're going to do. You're a carpenter, you're a woodworker, or whatever. And the giver is one person. And that giver has this role to help others, right? To give, in essence. And it's only one. And you can see the gaunt appearance of the giver and the cachectic because he's given so much. And the main character, that's going to be his role. He's going to be the next giver. And he has these things that he's not sure what to do or how to do it and how to be that. And how is he going to be like that for everybody? So it's his reflection on his journey through the role that he knows he's going to be, the role that he has accepted. But is it the one that he truly wants to do?
That's awesome.
That is so good.
Are we doing good? This is good. I'm enjoying this a lot.
Great, yeah.
Okay, so I have a question for you, Tim. You're growing up and you're 5'10", 250 maybe as you're getting bigger and stronger. Who are your role models and offensive linemen? Like, who did you want to emulate? Because most people want to be the next LeBron James or Michael Jordan or Aaron Rodgers.
I got 3 for you.
Okay, I'm in.
I'm a Jets fan, so you can't say Aaron Rodgers around here.
I'm a Packer fan, so I was glad he went to the Jets, actually.
Oh, I'm glad he's not on the Jets.
Sorry.
So they're all Jets offensive linemen. So number 1 was Kevin Mawai. Kevin Mawai was number 68, and that's why I was number 68 in high school. And the main reason is because he broke his hand and he had to get a cast, which looked like a nub, and he had this cast on there. And he was beating people with his cast, as offensive lineman against defensive lineman. I'm like, that's cool. He's got a broken hand that probably hurts, but he's using it to his advantage. He's finding his weakness and turning it into an advantage. So I thought that was cool, number 1. Number 2 was another New York center, Nick Mangold, who, big dude, just didn't care. And what I mean by that is that he was going to be the best person he could, and he was going to make sure that he did what was best for his team, and he didn't care what the opponent thought. He was making sure that he did what he thought was best for his team and to push his team forward. So that was great. And then my third one is DeBrickashaw Ferguson, who was the left tackle for the Jets as well, too. Two reasons. Number one, I got his autographed jerseys because I was wearing his jersey. We went to an event where we watched the Jets practice, and I made my way towards the buses when they walked out, and I had his jersey. I was the only person wearing his jersey. He saw me, came over, I took it off, and he signed it. That was cool, number one. Number two, the left tackle, and I was a right guard, so I was the pulling guard a lot. So I pulled around a lot. But to me, if you're looking at a right-handed quarterback, the left tackle is that blind side. If you've heard about the movie, read the book and all that, that's a great book, by the way. If I had a fourth choice, I'd probably talk about blind side there. But the blind side there, when a quarterback was a right-handed and he goes to throw, he can't necessarily see what's behind him. And you look at a lot of the injuries that have happened with quarterback sacks, it's always someone coming from behind. It's the hit that they can't see as opposed to the hit that they can anticipate. So having that protection there, protecting somebody's blind side, basically you're trusting somebody when you turn your back and you can't see that person, do they have your back? And they're going to make sure that they help you in a way. And again, that's a medicine approach as well. We got this medicine, I'm not sure what to do. Do you have my back? I have yours. You've been rounding for 10 hours straight. I'm not on call, but I'm going to come and help you because I know that you need help. So
further validation that sports are a metaphor for life.
Yeah, absolutely. Yeah. I have learned more in my time as a football player than any class could have provided. And I say, obviously, you need to go to medical school to become a doctor, and there's obviously importance in that too. But I'm not even just saying academic; I'm saying the life lessons that I learned. And it's such it's so important. And now, my kids, I'm trying to get them involved as much as possible there. And I told them even something as simple as, chess, right? Just having that where you're cordially competing, but you're pushing yourself in a way that's outside of the academics, that's outside of the classroom there.
Absolutely. So good. Your turn, Joe.
Oh, I get another one. I thought we were going to wrap it up. Okay. So my next one then, which is probably my last one. If you could invite anyone to dinner from any period of time, who would it be and why?
Are we going to get sentimental or no? Like, does it matter?
It's entirely up. That's the beauty of the question. It's entirely up to you.
So I never really got a chance to say goodbye to my father. And it was part of that Bruce Banner Hulk thing because I was in college. I was a senior in college. And I was like, I don't want to deal with this. I want to deal with this. And he passed before I say. So I would like that time with him just to basically say, hey, listen, this is what I'm doing. Look, I did it, and here you go. So that's the sentimental aspect of it. But if we're talking about famous people, right? We're going to talk about more famous people through that there. I think Abraham Lincoln is just such an incredible human being. And, obviously we don't really know who he was. This was all storytellings or factuals through history books. But I think Abraham Lincoln, just what he had to go through, half divided cannot stand. Like the turmoil of the country that it was in, or the state of turmoil that the country was in is just such an incredible time period and was such a formative years of who we are now. And, we talk about formative years for residents, and that was formative years of this country. And a lot of the enactments and the proclamations that were made during that time has still carried us to right now. And even looking back, we're still struggling with a lot of the things that we were struggling with in the 1860s, 150 years ago, even more. So it's just to see how he handled that and just to pick his brain about how even though he was the head of the country and he had this team around him, apparently he was very alone because he even had people on his staff that were against what he was doing. So he only had a few confidants that he could trust. And there were times that he would literally sit by himself in the library and just think and just had that seclusion just to hear his thought process through all that.
Yeah.
It's actually funny. This is going to tie us back to football as well, too, because I never forget in high school, I had to write an essay on a team. Who would I pick for a team? And I picked a football team, right? And I would pick different people to lead. And Abraham Lincoln was my quarterback, just through that there. But William Howard Taft was my center. Now, Taft was obviously president, but was the biggest president to date, weight-wise. And he actually got stuck in the White House tub. I don't know if you ever heard that story, but he got stuck in the tub of the White House. So that's why he was my center there. He wouldn't be a part of my dinner, but that was just kind of an offset right there. So, but a one-on-one with Abraham Lincoln. And then this is a great question. If I had one more to pick, so I'll give you the trifecta. If I had one more to pick, I would go with probably Ruth Bader Ginsburg. Yeah. And I think just because she dealt with so much through her life and what she had accomplished, not just as political, but just as a human, and her view on life as a humanist and the humanity at the end of the day, I think, and she, only recently passed, but just like I think it still resonates to this day. And if we had that voice and we had that idealism still in our current state of affairs, I think things would be different.
Yeah. I love that.
That is fabulous. It's true, Tim, that we could do Dean's Chat like 24/7, right? Because there's so many interesting people and there's so many great stories, but at some point we're gonna just have to have you back for another session because
I'm down.
We didn't get through like half of his accomplishments.
I know, and I got all these questions I haven't asked you yet. But anyway, Joe and I so appreciate you taking time. Just a fascinating discussion, and any of those individual topics we could have went on for an hour. So thank you for your eclectic interests and your insights to training and the psychology of kind of all aspects of everything we do. I just loved how we tied all that together. So thank you.
Absolutely. And I would love to come back. So if you ever have an opportunity, I know you guys have a long list and I know things are busy with you guys, but if there's ever an opportunity to come back, please ask me. I would absolutely love to do it. And Jeff and Joe, I think these Dean's Chats are absolutely fantastic. I think I've had a chance to watch many of them and many of my colleagues that I know and colleagues that I wish I knew, just to get insight on them. It's just a fantastic look into the mindset of our profession. And that the fact that you take the time to do this is incredible. And I appreciate that you guys do it.
Well, thank you, Tim. We appreciate that. Well, for all of our listeners out there, if you're listening on Spotify or Apple, we always appreciate 5-star ratings. But if you could leave a comment, that would even be better. And if you're watching on YouTube, by all means, become a subscriber. And, you can leave comments on YouTube also. Joe and I will continue to bring leaders in our profession. And as Joe often says, the most interesting people do not have a circuitous route. And it's so true. And there's so many great stories behind all of our guests. So, Tim, thank you so much for a wonderful episode today.
Absolutely. My pleasure.
We're going to send you a Dean's Chat mug. I don't know what your drink of choice is, but this will accommodate it for sure.
Absolutely. I'm down.
All right.
So much. I'll drink it with pride. So.
All right. Sounds good. Well, cheers, everybody. We'll see you next week.